Good morning. This is Dr. Timothy Scott Beck here at Life Point Medical. And I want to say good morning to you. It's Monday morning, August the 5th of 2024. And we're up and running this morning like usual. Hope you're having a good day and had a good weekend. We certainly did. Let's go ahead and I just want to quickly throw some things at you, and then we'll be on with our day. First of all, one of the things that I often talk about here is the water consumption. And as the heat rises in the community, it's more likely for you to get dehydrated and things like that. So it's more important, obviously, if you're in a lot of heat, to increase your water compensation. But here's the thing. The increase in heat causing more dehydration causes more people to get gout attacks. Okay, and gout is when uric acid crystallizes in your joints. And if you ever looked at a crystallized uric acid in a microscope, it looks like little shards of glass, like the ones that you get when you break something in your house and you have these little tiny pieces of glass all over the place, and you get them in your foot and things like that. Well, that's what's in your joint. So let's talk a little bit more about gout. Gout is the crystallization of uric acid in your joints. The number one place where it happens in your body is your right great toe. Now, we don't know why it's always your right great toe, but it does seem to be always people's right great toe. And it's certainly when somebody comes in and they've got a complaint of their right great toe hurting, we're always putting that on our list of, okay, is this gout? Or we've got to make sure it's gout or make sure it's not gout, whatever the deal is. So, but you can have gout in any joint in your body. And what it does is it causes severe acute pain in that joint. We have several medications that we treat it with, like steroids, anti-inflammatories, and a medicine called colchicine. And we can treat your gout acutely with those things, and it's usually very effective, and it knocks the gout out almost instantly sometimes when we give people the right medicine. So here's a few things. So I had a patient come in last week who could not walk, and I said, "You got gout. I can tell by the way it looked." He said, "Yeah, I got it, but I've been held off for 3 days trying to see if it'd get better." And that's the thing I really want to talk to you about, is if you get a gout attack, every day that you have those crystals in your joint, the more damage you get to your joint, okay? And that's why if you think you've got gout, I want to see you that day. I don't want you to wait 2 or 3 days, okay? Because it's unnecessary pain and suffering. It does damage to your joints, and it can be treated pretty easily, and it needs to be taken care of as soon as possible anyway. And you want to curtail any long-term damage to that joint, because I think the longer it sits in there, I really do think it just damages the joint more and more. So if you've got gout, so what's the ways you prevent gout from occurring? There we go. We're back to drinking water. Okay, so a gallon of water a day will stop you from having gout almost across the board. Okay, and that's what the American Arthritis Association said years ago, and I do believe that's true. So the number one way to prevent gout is to stay hydrated, because those crystals have to be in a certain concentration in your joint to actually crystallize and cause you to have problems. So dehydration water keeps it diluted down so that you don't have crystallization of the uric acid in there. So that's number one. Number two, when you do have gout, sometimes we'll check your uric acid levels, and it could be elevated or not. And if it is elevated, we can give you a medicine called allopurinol, but you have to start allopurinol in a right way, and it has to be managed by a doctor. And we do that all the time for people, but we usually do it after patients have had 2 or 3 gout attacks in a pretty close succession. Then we'll start looking at doing some permanent treatment to keep them from continuously having problems with the gout. So if you think you've got gout, or you think a loved one has gout, come see us, and we'll get them taken care of, and we'll look at them, and we'll help them prevent it from from getting worse and use the correct medications at the correct time if they need to. All righty. Otherwise, we're doing well here. We're pushing those annual wellness visits. The weight loss shots are doing great, and people are still participating. We've still got a heavy participation in that. So we're doing good here. The main thing I want to reiterate, and the thing that I reiterate every time I talk to you, is if you have a problem, call us so we can get you seen quickly and get you taken care of, so that maybe we can prevent you from going to the hospital or suffering unnecessary pain and suffering because we didn't treat you earlier, you didn't get treated earlier. Okay, 706-782-0016 is our number. We've got about 5 people answering the phones at all times, but we only have 3 lines. But the people that are answering the phone are directed to answer the phone within 3 rings. So we're trying to get you listened to and get you taken care of as soon as possible. Thank you for listening to this video. Make sure you drink plenty of water in this heat, and I'll talk to you later.